Hello guys, if you don't understand the PQRST structure, ECG interpretation will be difficult. Let's build a strong foundation first. Before moving further, we should know about depolarization and repolarization. So first, depolarization means the heart muscle cells become electrically activated, causing them to contract. Repolarization means the heart muscle cells return to their resting electrical state after contraction. This allows the heart to relax and prepare for the next heartbeat. In depolarization, sodium enters the cell, the heart muscles contracts. On an ECG, P wave indicates atrial depolarization. QRS complex indicates ventricular depolarization. In repolarization, potassium leaves the cell, the heart muscle relaxes and gets ready for the next beat. On an ECG, T wave indicates ventricular repolarization. P wave represents depolarization of the atria. Atrial depolarization spreads from SA node towards the AV node and from right atrium to the left atrium. QRS complex on an ECG indicates ventricular depolarization, the electrical activity that causes the ventricles, which means lower chambers of the heart, to contract and pump blood. Right ventricle, which pumps deoxygenated blood to the lungs through the pulmonary artery. Left ventricle, which pumps oxygenated blood to the entire body through the aorta. T wave on an ECG indicates ventricular repolarization, the electrical recovery of the ventricles, allowing them to relax and prepare for the next heartbeat. PR interval, passage of the electrical impulse from the aorta to the ventricles through AV node and bundle branches. Normal PR interval 0.12 to 0.20 seconds or 3 to 5 small boxes on ECG paper. RR interval, distance from the peak of one R wave to the peak of next R wave. QT interval, the time from the beginning of the QRS complex to the end of the T wave. It represents the total time of ventricular depolarization and ventricular repolarization. PR segment. The PR segment is the short pause while the electrical signal travels through the AV node before it enters the ventricles. It gives the ventricles enough time to fill with blood before they pump. This makes the heart pump efficiently. ST segment is a flat line between the end of the QRS complex and the beginning of the T wave. Ventricles remain fully depolarized. Ventricles are actively squeezing and ejecting blood. J points, the point where the QRS complex ends and the ST segment begins. U wave, a small wave after the T wave. A prominent U wave is commonly associated with low potassium, which is called hypokalemia. In my next video, I will update ECG changes.